By the time you finish watching this video, at least 3 more seniors will have received a dementia diagnosis they never saw coming. 3 families, 3 lives turned upside down. And here's the part that should stop you cold. In many of those cases, the real trigger wasn't aging. It was something they were taking voluntarily, every single day. What if I told you that some of the most trusted, most prescribed, most harmless-looking medications on the market today have been quietly linked to accelerated memory loss and cognitive decline in people over 60? And what if the drug sitting on your nightstand right now is one of them? Stay with me, because what you're about to hear in the next few minutes could genuinely change how you think about your own health, and maybe the health of someone you love. My name is Dr. Gregory Holt. For over 15 years, I've worked exclusively with patients over the age of 60, focusing on brain health, healthy aging, and what I call invisible threats. The slow, silent factors that chip away at cognitive function long before anyone notices something is wrong. I've sat across from thousands of patients who came to me confused, foggy, and frightened, convinced they were developing Alzheimer's. And in more cases than I can count, the culprit wasn't a disease, it was a prescription. In this video, I'm going to walk you through 5 categories of commonly used medications that have been scientifically linked to memory loss, cognitive decline, and in some cases, full-blown dementia. I'll explain exactly what they do inside your brain, why doctors still prescribe them, and most importantly, what you or your loved one can do right now to protect yourself. Before we go any further, I want to be clear about something. Everything I share here is strictly educational. This video is not a substitute for professional medical advice, and nothing I say should be taken as a directive to stop or change your medications without consulting your doctor first. Your brain health deserves proper, personalized medical care. What I want to do is give you the information you need to ask better questions and have more empowered conversations with your healthcare provider. Now, let's get into it, starting with a drug that's probably in your bathroom cabinet right now. Let's start with a category of medications that goes by a name most people have never heard, but that millions of people take every single day without a second thought. We're talking about anticholinergics. That's a mouthful, I know, but here's the simple version. Your brain relies on a chemical messenger called acetylcholine to form new memories, stay alert, and keep your thoughts organized. Think of acetylcholine like the electrical current running through the wires of your brain. Everything depends on it. Now, anticholinergic medications work by blocking that current. They're designed to do that for legitimate reasons, to relax muscles, reduce bladder spasms, dry up secretions. But when you block acetylcholine in an aging brain, the consequences can be severe. I want you to think about a patient I'll call Margaret. She was 68, sharp as a tack her whole life, a retired school teacher who did crossword puzzles every morning. Within 8 months of starting a medication for bladder control, her daughter brought her to see me in a panic. Margaret was forgetting conversations she'd had hours earlier. She was getting confused on familiar streets. She was becoming a different person. When we reviewed her medications, we found she was on not 1 but 2 anticholinergic drugs simultaneously. Nobody had told her. Nobody had connected the dots. The research backs this up with frightening clarity. A landmark study published in JAMA Internal Medicine followed over 3,400 adults aged 65 and older for 10 years. Those taking higher doses of anticholinergic medications had a 54% greater chance of developing dementia than those who avoided them. That is not a rounding error. That is more than half again the normal risk. And the medications involved? You'd recognize them immediately. Diphenhydramine, that's Benadryl. Oxybutynin for bladder control. Amitriptyline for pain or sleep. Promethazine for nausea. These are common, these are trusted. And in seniors, they can be genuinely dangerous. If you or someone you love is taking anything for sleep, allergies, bladder control, or nausea, I want you to write this down and ask your pharmacist one simple question. Is this medication anticholinergic? That one question could change everything. And don't go anywhere, because number 2 on this list is something that millions of seniors take every morning with breakfast, completely convinced it's protecting their health. They may only be getting half the story. Let's talk about a drug class that's been celebrated for decades as one of the great achievements of modern cardiology. Statins. Medications like atorvastatin and simvastatin, sold as Lipitor and Zocor, are prescribed to lower cholesterol and reduce the risk of heart attacks and strokes. For many people, they are genuinely life-saving. I want to be absolutely clear about that. But here is what most patients are never told during that 5-minute appointment. Your brain is made up of nearly 60% fat, and cholesterol isn't just a bad guy your body is trying to get rid of. Cholesterol is a critical building block for the myelin sheath, the protective coating that surrounds your nerve fibers and allows signals to travel quickly and cleanly through your brain. Think of it like the insulation around an electrical cable. When that insulation thins or degrades, signals get lost, scrambled, or delayed. Over time, that translates into slower processing, memory lapses, and mental fog. Here's what the science is showing. A 2023 study published in Frontiers in Aging Neuroscience found that seniors over 70 who had been on statins for more than 3 years had a 26% higher risk of mild cognitive impairment compared to those who weren't on these drugs. More alarming, some patients reported sudden memory episodes, moments where they couldn't recall a familiar name or lost track of a well-known driving route, seemingly out of nowhere. Now, the picture is nuanced. Not all statins behave the same way. Medications like pravastatin and rosuvastatin cross the blood-brain barrier less easily and carry a lower cognitive risk profile. But lipophilic statins, the ones that do penetrate the brain, deserve a much more careful conversation. If you've been on a statin for several years and you've noticed increasing mental fog, difficulty concentrating, or memory that doesn't feel quite right, bring it up. Ask your doctor whether your specific statin is lipophilic, whether a lower dose is possible, and whether your cholesterol levels could be supported through dietary and lifestyle changes. You deserve the full picture. We're only at number 2, and already you're getting information that most doctors don't have time to share in a standard appointment. Keep watching, because number 3 is one that's hiding in plain sight, often prescribed for something most people consider completely minor. This next one surprises nearly every patient I bring it up with. We're talking about proton pump inhibitors, or PPIs. These are medications taken for heartburn, acid reflux, and GERD. Prilosec, Nexium, Prevacid, brands that have become household names, sitting on drugstore shelves as if they're as safe as vitamins. Here's the problem. Your stomach acid isn't just there to irritate you. It plays a critical role in absorbing certain nutrients, particularly vitamin B12, magnesium, and calcium. All 3 are essential for healthy brain function. When you suppress stomach acid aggressively, day after day, month after month, your body's ability to extract those nutrients from food plummets. Low B12 in seniors doesn't just cause fatigue. It causes neurological changes that look remarkably similar to early Alzheimer's. Numbness, cognitive slowing, memory disruption, mood instability, and here's the cruel twist. Because these symptoms develop gradually, they're almost always attributed to just getting older. Nobody questions the medication, but the research has been making waves. A 2016 study published in JAMA Neurology examined over 73,000 adults aged 75 and older and found that regular PPI users had a 44% increased risk of developing dementia compared to those who didn't use these drugs. More recent research has also pointed toward a possible link between long-term PPI use and increased amyloid beta plaque buildup. Those are the same toxic proteins considered a hallmark of Alzheimer's disease. Many people end up on PPIs after a single bout of reflux and stay on them for years because their symptoms return when they try to stop. That rebound acid effect is real and uncomfortable, but it's often manageable with a slow, supervised tapering protocol combined with dietary adjustments. Options like H2 blockers or natural stomach-soothing compounds like deglycyrrhizinated licorice may offer real relief with a much gentler profile for your brain. If you've been on a PPI for more than 3 months, it's worth asking your doctor whether you truly still need it at the current dose and whether your B12 levels have been checked recently. 2 more to go, and these final ones are the ones that catch most families completely off guard. Please don't skip ahead. Let's talk about benzodiazepines, because this is one of the most important conversations I have in my practice, and one of the most difficult. Medications like alprazolam, diazepam, and lorazepam, sold as Xanax, Valium, and Ativan, are among the most prescribed drugs in the country for anxiety and sleep difficulties. They work quickly, they feel effective. For someone lying awake at 2 a.m. with racing thoughts, they feel like a miracle, but the brain adapts to them fast. And for adults over 60, the long-term risks are serious and well documented. Here's what happens inside the aging brain. Benzodiazepines enhance a neurotransmitter called GABA, which essentially acts as your brain's natural quiet-down signal. In the short term, that's calming. But over months and years, the brain essentially reorganizes itself around the drug. Neural pathways slow down. The brain becomes less capable of learning, adapting, and forming new memories. It's like putting the engine of your mind into a long, slow idle. And over time, that engine starts to lose its power. A major study published in the British Medical Journal tracked over 8,000 seniors for 6 years and found that those who had used benzodiazepines for longer than 3 months had a 51% increased risk of developing Alzheimer's disease. For long-acting versions like diazepam, which accumulate in body fat over time, the risk was even higher. What makes this especially heartbreaking is the trap it creates. When someone tries to stop, the anxiety and insomnia come back, often worse than before. So the medication feels necessary, when in reality it has become the primary driver of the very symptoms it was meant to treat. If you've been on a benzodiazepine for more than a few weeks and you want to explore coming off it, please do not do so abruptly. That can be dangerous. Work with a physician on a slow, gradual taper, often over weeks or even months. Cognitive behavioral therapy for insomnia, often called CBTI, has shown strong results. Non-habit-forming options like low-dose buspirone or certain evidence-based supplements may also support the transition. You don't have to be trapped, but you do need proper support to get out safely. One more, and this last one is the one that most people, and sadly even most doctors, completely miss. Let me end with what I consider the single most dangerous, most overlooked drug-related threat to cognitive health in seniors. It doesn't have a single name on the bottle. It doesn't come in one color or one shape. It's called anticholinergic polypharmacy. And it means this: taking multiple medications at the same time that each have anticholinergic effects. Let me make that concrete. Imagine a 73-year-old man, let's call him Robert. Robert takes Benadryl to sleep. He takes oxybutynin for bladder urgency. He takes a low-dose antidepressant prescribed years ago for chronic pain. Each of these drugs on its own might cause only mild, barely noticeable cognitive effects in a younger person. But in Robert's brain, the effects don't just add, they multiply. Each one is blocking acetylcholine from a slightly different angle. The cumulative burden on his neural chemistry is enormous, and nobody, not his GP, not his cardiologist, not his urologist, has ever sat down and looked at his complete medication list as a whole. A 2022 analysis published in Age and Aging tracked more than 280,000 older adults and found that those with the highest cumulative anticholinergic burden had a 120% increased risk of developing dementia within 10 years. Double the normal risk. And the overwhelming majority of them had absolutely no idea they were on anticholinergic medications in the first place. This is not a rare edge case. This is happening in homes and care facilities across the country right now today, and because the cognitive decline is gradual, because it mimics natural aging so perfectly, it almost never gets traced back to the medications until serious damage has already occurred. Here's the genuinely hopeful part of all this. Unlike genetic conditions, unlike some forms of progressive neurological disease, drug-induced cognitive decline is often reversible, especially when it's caught early. When the anticholinergic burden is lifted, many patients report dramatic improvements in mental clarity, memory, and energy within weeks or months. Your brain is not passive. It is remarkably resilient, given the chance to heal. The single most important thing you can do right now is ask your doctor or pharmacist to conduct a full medication review, every prescription, every over-the-counter drug, every supplement, and specifically ask them to calculate your anticholinergic burden score. There are validated clinical tools for this. It takes minutes, and it could make an enormous difference. Let me bring this all together quickly, because I want these 5 points to stay with you long after this video ends. First, anticholinergic medications, including common sleep aids, allergy pills, and bladder medications, can block the very brain chemical needed for memory formation. Second, certain statins, particularly those that cross into the brain, have been linked to cognitive impairment in long-term users over 70. Third, proton pump inhibitors for acid reflux can deplete the B12 and other nutrients your brain depends on. Fourth, benzodiazepines for anxiety and sleep, taken long-term, can progressively slow and impair neural function in aging brains. And fifth, and most critically, taking multiple anticholinergic medications simultaneously creates a compounded, dangerous burden on your cognitive health that most doctors never screen for. None of this means you should panic. It means you should be informed. It means you should ask questions. It means you should advocate for yourself. If this video gave you something to think about, something to bring up with your doctor, or something that finally explained what you or a loved one has been experiencing, then it did its job. Consider subscribing if you want to keep getting this kind of honest, research-backed health information built specifically for adults over 60. No fluff, no fear for its own sake, just the knowledge you deserve to have. I'm Dr. Gregory Holt. Take care of that brain of yours. It has a lot of good years left in it.